All right, where are you? Um, so for patient number one, what is the treatment threshold for a FRAC score?
Treatment threshold for a FRAC score for patient who had a T score that doesn't meet the osteoporosis criteria. You can use a FRAC score to calculate whether or not you should treat them, and the value is major osteoporotic fracture greater than 20% or a risk of hip fracture greater than 3%, then you would treat this patient.
What would be the first line treatment?
First line treatment will be bisphosphonate.
Okay. And how do you administer bisphosphonates?
Bisphosphonate is a oral medication or an IV injection.
Okay. What vaccines would you recommend for this patient?
At 65, I would recommend uh, pneumococcal, shingles, COVID vaccine, flu vaccine, um, uh, yeah, for this patient, I would recommend those.
Okay. And did you say COVID vaccine?
I did.
Okay, good. Um, since she did not meet criteria for bisphosphonates, what would you recommend for her bone loss prevention?
So I counseled this patient about having moderate, uh, uh, regular weight-bearing exercises. Um, Make sure she has enough calcium and vitamin in her diet. If it's not enough, she should have supplementation. The total amount of calcium for her should be 1200 milligrams daily, and for vitamins, it should be 600
Okay,
international units.
great. Okay. And then let me go back to the list. That is my list. That is the wrong list there. All right, and then for patient number two, what is the treatment for chlamydia?
Chlamydia, um, for the treatment for chlamydia is doxycycline, 100 milligrams um, BID times 14 days.
Is there another treatment?
You can also use azithromycin 1 gram one time. Usually you use that for pregnant patients.
What's the treatment for gonorrhea?
Gonorrhea is cephalotriaxone 500 milligrams IM. One
Okay.
time. One time.
Okay, unrelated, but it was ureaplasma.
Oh, it was?
Yeah. And it's
That,
on the Sure Swab Advanced Vaginitis Plus.
okay, so it's a different swab.
Yeah.
Okay. All right. I was
Um,
just telling you that it wasn't on that Ultima thing.
and no, dude, I was just like, did I fuck up that hard? Like, huh, go figure that out.
Yeah.
Okay. When do you rescreen for chlamydia, for a chlamydial infection?
I usually do 3 months.
What if she's pregnant?
Uh, you mean she got pregnant within that 3 months?
If she was already either.
Oh, I will probably do 1 month.
Is there a chance that she would still be falsely positive at that point?
In 1 month?
Yeah.
Mm, falsely positive, as in there's still uh that I'm not sure actually. I will have to look that up.
Okay. And then for patient number 3, are there any other tests that you do for IUD insertions?
So, for IUDs, I usually obtain a history and physical. Um, I usually do a ultrasound in the office just to make sure the uterus doesn't look abnormal, um, such as a large fibroid that could be blocking um, the entrance of the cavity, or a um, some kind of bicornuate uterus. Um, I also ask the patient about possible signs and symptoms of pelvic inflammatory disease or STDs. And if anything, if that's positive, I would treat her first before inserting the IUD.
Okay. Do you need to test for STDs prior to insertion?
You do not prior. If patient has no signs or symptoms, then you do not have to test.
Okay. Um, and then for patient 4, uh, what is the significance of her triglycerides?
So for this patient, I was concerned for metabolic syndrome, and that's why I did order um, lipid panel and diabetes screening for her. And because she does have elevated triglycerides, and her her waist circumference is greater than 35, she doesn't meet the criteria for a metabolic syndrome.
Okay. Um, mm, mm.
Oh, we have to talk about
Would you start
metabolic
when?
syndrome.
Yeah. That, I was like, I still have to look up.
Yeah, I
Well,
forgot to
the
talk to you about that
problem
one.
is that I'm super confident bullshitting and being wrong. Triglycerides.
It's
I
fine.
was,
You still
I
have a
was
lot of
close.
time. So
I was
you
so
can
close.
be, it's good that you're confident. Now you just, work on that being wrong part. Just,
They're
you
gonna
can
be
work
like
on that.
this. They're gonna be like, this bitch. Um, so, for this patient, would she need antenatal surveillance during her pregnancy?
She is class 2 diabetic. Um, Anybody with uh
Class 2 diabetic or class 2 obesity?
oh, I'm sorry, class 2 obesity, and also she has chronic hypertension. So yes, she does meet the criteria for antenatal testing.
Do all chronic hypertensive patients need to have antenatal surveillance?
Uh, I believe so.
Okay. Um, Patient 5, what labs were positive for her antiphospholipid syndrome? Or
Uh,
what tests comprise antiphospholipid syndrome testing?
so it comprises of three tests: lupus anticoagulant, anticardiolipin, antibodies, and anti-beta 2 glycoprotein antibodies. And for this patient, her anti-cardiolipin was positive.
Okay. Does she need to be on what type of anticoagulation does she need to be on?
I started her on just prophylactic dose of heparin. For her, it was low molecular weight heparin.
Okay. Would you continue that postpartum?
Yes, for 6 weeks.
Cool. What is the rate of SAB with APLS?
SAB. Without treatment?
Without treatment.
Without treatment. I don't know the exact number, but I would guess it would be around 20%.
Okay. And what is the risk for in the pregnancy for APLS?
The risk during pregnancy if you have APLS.
Yes.
Um,
Besides miscarriage, and we talked about blood clots.
well, that's the two big things.
What else is there?
Let me think. Um, I would think the patient will have fetal growth restriction,
Yep.
preeclampsia. Uh, so we talked about stillbirth. Um, probably
We didn't
abruption.
say stillbirth. We said SAB.
Oh, okay. So stillbirth then. Stillbirth, uh, placental abruption, increased risk for C-section.
Okay.
Yeah, that's
Sure. Yeah.
yeah.
Um, all right. For patient number 6, what's your differential diagnosis for bilateral labial ulceration?
So for a patient this age, my top concern would be squamous cell carcinoma. Um, Outside that, this could have been a lichen sclerosis, lichen simplex chronicus, um, and just contact dermatitis. Um, Lower on the differential will be ulcers related to sexual transmission, such as LGV, um, things like that. I think that's the top ones.
Um, would you consider Behcet syndrome?
Um, it could definitely be it could definitely be the part of the differential, yes. But she will have other ulcers or lesions in other areas of her body, not just the labia.
Um, and I think that's kind of all I looked at before we start doing this.
That's
Oh, for
cool.
number 12, did you do her BSO?
Number 12. No, I did not. I didn't do the
Okay,
TAHBS. She just came in with that.
cool. Um, they're probably gonna ask you like she had a reason it was done.
It was for endometriosis.
Okay, cool. Great. For that's you can have other ulcers, but it's only you could have just 3 oral ulcers in 1 year. and then have the labial ulcers.
Wait, what are we talking about?
Sorry,
Bassets? Bachet?
back to patient 6.
Bat? What is it called?
Behcet.
Bassets? Bachet?
Behcets. I don't know how to say it. I only know how
Yeah.
to spell it.
Wait,
So
say that again? You can.
Behcet,
No,
you
no,
can have
no.
you could
Uh-huh.
have just 3 oral ulcers in 1 year,
Mm-hmm.
and then you could have the genital sores. So like it doesn't need to be everywhere.
Oh, I see.
Um,
How
so
would you even test that? Like some kind of
you
autoimmune
literally
antibody or something?
it's EBV. So there's like nothing you do. You just basically do steroids and topical lidocaine.
Oh, okay. But now how do you diagnose? Biopsy?
It won't be on the biopsy. It's you rule everything else out. So
Oh.
you do herpes, you do a biopsy, like numb the shit out of it, do a biopsy. And then if it goes away with steroids and the EBV is positive, then you're like, all right, maybe.
Hmm. Okay.
In residency, we had one of those.
You did, huh?
Um, and so anyway, that's I would think with bilateral ulceration, they could ask that.
Yeah, definitely.
And then
And then number
I
five.
I
The,
think for number 5, I didn't ask it, but if you would do antenatal testing, antenatal surveillance.
yeah, because the increased risk for stillbirth.
Um, and then if they and like when would you induce? They could ask.
Mm, that's a good question. I want to say, I don't know.
I think that you would be able to say shared decision making because usually, if it's like a term demise, you do it a week earlier. In the subsequent pregnancy, but at 27 weeks, you would probably discuss doing it at 39.
Oh, so actually the stillbirth, the recommendation is 39. You're not supposed to
Yeah.
do a week earlier. You can do the antenatal testing a week earlier or starting at 30, I think 32 weeks, whichever is
Yeah.
earlier, but um unless they have severe anxiety, you're
Right.
supposed to do it at 39.
Yeah.
Yeah.
Yes. So anyway, they may ask that.
Yeah.
Um, but yeah,
But
otherwise,
yeah, I have to look it up. When induce.
yeah, definition of metabolic syndrome. I was pretty close with my bullshit answer though.
Yeah, no, it was good. So it's
Um,
3 out of the 5. And then the triglyceride is actually 150, not
yeah, it was
one.
150.
Yeah.
Because I remember from Wall's study course for the writtens that it's like you only have to memorize a few numbers. It's 35, 130 over 85, and 150. So if you have 3, 5, and 8, you're good. You
Mm,
just have to remember the combo.
yeah.
Um, so yeah, anyway. Uh,
But I was correct, right? The
no, you're
chronic hypertension, you're supposed to
so
mon.
chronic hypertension, you actually don't need to if it's unmedicated.
Oh, okay.
So only chronic hypertension on meds. With her, the fact that she has recurrent AB class 2 obesity, you would. Because her combined risk of stillbirth is higher than just a normal unmedicated chronic hypertensive.
Right.
And she's medicated, so she would, but not
Right.
if she was unmedicated, no.
Yeah.
And then yeah, you got the treatment for gonorrhea, chlamydia. Chlamydia can have a false positive, um, up to 6 weeks. That's why outside of pregnancy, we usually test at 6 to 12. But in pregnancy, because it's so important that it's treated, test at 4 to 6.
Uh-huh. Got it. What
Um,
about the IUD? You asked
so
about.
if they've never been screened for STDs, and screening can be done at the time of insertion.
Right.
But you don't actually need to have an ultrasound. You just need to do it by manual.
Hold on, sorry. Hospital calling. 1 second. Hello?
Hi, Dr. Chen. This is calling from San Gabriel Labor and Delivery. Regarding your patient in 708C, the one that has cerebral, she's asking if she can eat.
Yeah, she can eat. That's fine.
She can just,
She can eat.
all right.
Uh-huh. Okay. Annoying.
Yeah, dude. Being a doctor, huge mistake. Like, I don't know if like you're probably in the same boat, but like culturally, I was only supposed to be a banker, lawyer, or doctor.
Mm-hmm.
And I'm happy out of the three that I picked medicine, but I don't like it.
Oh, too late.
Oh yeah, no backsies. Um, that's all right.
Um,
I have a pretty car. It's okay.
yeah.
And then, but yeah, so that's all you actually have to do is a bimanual. If they've never had a test, you do testing at the time of. If during
Okay.
like
Even if they're like older, where they don't have a lot of risks, you would still do it.
they've probably at that point been tested at some point. This is if they've never had a screening test.
Oh, okay. Got it.
So it'd be really weird to have a 42-year-old who never once got screened for gonorrhea chlamydia. But if she hadn't, yeah, you would do it.
Okay. So you don't have to do like all that ultrasound nonsense.
No,
Yeah, I
just by
don't.
man.
Yeah, I don't do that shit. But
Yeah,
I feel
no,
like I had to say those.
no, fucking none of us do. Who's got the time for that?
Right?
No, so that would be the only time. And then uh, yeah, yeah, cool. Great job, Dr. Chen.
We'll see.
Did they give you a date yet?
Nope. It's one
Oh,
one
fucking
week
rude.
before. It's annoying.
1 week, not 1 month?
Oh no, 1 month. Sorry. 1 month.
Oh my God.
I know.
I was like, I'm not going to Dallas